Daviess Community Hospital has a unique approach to care.
It's not just the healthcare that you provide over here, it's about what happens when you leave.
Dr. A.J. Kumar came here to fill the shoes of his uncle and mentor.
There is an old idea about what we call traditional medicine. That is, you have your own clinic, you see the patients in the hospital, when they get discharged, you follow them, and you just become the part of their daily life. But that's what Dr. Lohano believed in.
Dr. Lohano was tragically killed in an automobile accident, and now his team carrying on his work of a new rounding procedure.
This is the third hospital I've worked at, and no hospital that I've worked at before has had something like this.
Jacelyn Schweitzer is a nurse who sees the benefit of this rounding firsthand.
I find it very beneficial, not only for the patient, they get to be involved in their care, they get their questions answered, families present most of the time, they get their questions answered, but it's also very beneficial for the nurse. If I have a concern, I can bring it up in front of the patient with the patient. It gets addressed right then and there, and it's nice to have everyone included. Like medication questions, I have the pharmacist right there. If I don't know where the patient's going, if they're not going home, I have case management right there. It's just very helpful to get my job done versus sitting on a phone all day.
Linda Myers was a patient whose health journey at Daviess Community Hospital started with emergency care.
Right from the beginning, when I got to the ER, it was a team taking care of me. It feels like you've become a real person to that team, and you're not just a name in the computer. So I think that's good. I think it makes for more open communication, and you know somebody's face, so it's easier to ask a question.
Linda's son is thankful for the approach his mom has been given.
It was very comforting to see a team of people come in here and communicate amongst themselves and with my mom and myself. It was a lot more, it just seemed efficient that way, and it was very personalized, and everybody knew what was going on, and it was just a relief when you're sitting where I'm at having concerns and wondering what's going to happen, to be able to get the information you need and then to get questions answered. It was very comforting to know that that was how they were handling it.
I just travel with the care team in the patient rooms, and while I'm in there, I review medications from home and make sure that we have the medications on accurate list, which is difficult across the country for any hospital to do. So it's really nice to do that while we're talking with the patient upon admission.
Annie Williams is a pharmacist, and seeing the patient in person can make dosing medicine more effective.
Now that we get the whole picture, it makes everything easier.
And Annie will tell you so many of the patients are familiar faces and friends.
It is a community, so a lot of these patients, I might not know them, but I know their cousins, their nieces, their uncles. It is very much community-based, and so almost everybody is connected in some way to somebody here. And so, yes, to be able to put a familiar face together, make them feel more comfortable with us, and seeing, our patients going home, it is good.
The Mobile Integrated Health Program follows patients home and oversees their care too.
We help them navigate the healthcare system. So with the MIH program, if they see multiple doctors and need additional procedures done, then we can help them navigate that. We help educate them so they can do this on their own, but we're that extra support.
At Daviess Community Hospital, patients know around every corner this team has their best interest in mind.
Every day there's a parade of people coming in here testing, and are you all right? Do you need anything? So you get a feeling that even though the door's closed, there are people on the other side of it who care about you and who want you to have their very best care.